Welcome. My name is Shavar Johnson, SIBA specialist with the California Prevention Training Center, and this presentation is called Cluster Detection and Response Planning, an overview of the CDR workshop series. In this presentation, I'll provide you with an overview of the CDR workshop series that will be hosted by the California Prevention Training Center. So let's get started by reviewing a roadmap of what you can expect in this presentation today. The presentation will begin with an overview of CAPTC and our Capacity Building Assistance Program, so you'll know a little more about who we are and the work that we do. I'll then provide a review of HIV cluster detection and response, and then segue into the overview of the CDR workshop series by looking at the purpose, activities, and each day of the series. The presentation will then conclude with an overview of the CDR subgroup that has been created on group site as an online space where you can learn from and support other health departments that are finalizing CDR plans. So let's take a moment to learn more about CAPTC and the SIBA program. The mission of CAPTC is to provide training and technical assistance in HIV, STDs, and sexual and reproductive health to strengthen the health provider workforce capacity. CAPTC has delivered trainings and technical assistance to health professionals throughout the United States and beyond for nearly 3 decades. Under our PS 19-1904 cooperative agreement with Centers for Disease Control and Prevention for Component 2, Track C, CAPTC works in communication, collaboration, and coordination with our Track A provider, Denver Prevention Training Center, and our Track B provider, San Francisco Department of Public Health, to deliver technical assistance to our jurisdictional partners in the West region of the country. As a Track C SEPA provider, CAPTC offers technical assistance in the area of HIV, HTV transmission clusters and outbreaks, which includes CDR planning and implementation. To make sure we are all on the same page in preparation for the CDR workshop series, let's take a moment to quickly review HIV cluster detection and response. According to Centers for Disease Control and Prevention, a transmission cluster is a group of persons living with HIV, either diagnosed or undiagnosed, who are connected by HIV transmission. A transmission cluster represents a subset of an underlying risk network with ongoing HIV transmission in a population where prevention efforts could prevent new infections. A risk network includes the group of persons among which HIV transmission has occurred and could be ongoing. This network includes persons who are not living with HIV but may be at risk for infection, as well as those living with HIV in the transmission cluster. Transmission clusters can be identified through multiple mechanisms: time space cluster detection, molecular cluster detection, and other cluster detection methods. So now that we're on the same page, let's dive into an overview of the CDR workshop series by reviewing the purpose, activities, in each day of the series. The purpose of the CDR workshop series is for you and other health department staff who are engaged in CDR planning and implementation to exchange information and ideas about the internal resources, external partnerships, and potential need for additional technical assistance for a robust CDR plan. To meet this purpose, we're hoping that you, as an attendee of the workshop series, will explore opportunities to engage and increase support for CDR among internal and external stakeholders, strategize solutions to address barriers to effective CDR documentation and planning, and showcase CDR best practices among health department jurisdictions in the West geographic region. Each day of the workshop series will focus on a different area to help you in finalizing a robust CDR plan. Day one, which will be February 24th, will focus on internal staffing, roles, and responsibilities. In this workshop, you will determine the leaders and champions that you can engage from departments and programs within your larger health department organizational infrastructure, as well as identify mechanisms for effectively engaging those needed for CDR planning and implementation. To support us in this workshop, we will have a representative from Washington Department of Health who will present their best practices in this area. On day two, February 25th, we will focus on external resources and partnerships. In this workshop, you will identify community stakeholders and external partners to engage in CDR planning and implementation, discuss the rationale for including representation from community groups most impacted by HIV in CDR planning, and identify mechanisms for effective community engagement strategies to leverage CDR planning. To support us in this workshop, we will have a representative from Oregon Health Authority, Public Health Division, who will present their best practices in this area. The final day of the workshop series, February 26th, will focus on next steps in identifying additional CDR technical assistance. During this workshop, you will share your health department's progress in developing your CDR plan. You will also identify those next steps to support finalizing your CDR plan and identify potential need for additional technical assistance. For each day, we'll be looking to you as an attendee to participate in thought provoking and strategic conversations where you can share your best practices and learn from other health departments who are either presenters or in attendance alongside yourself. So, to ensure that we have those conversations, you'll be participating in both breakout room and large group discussions during each workshop. We're reaching the end of the presentation, but before we conclude, let's look at an overview of the CDR subgroup on GroupSite. GroupSite is an online platform that is currently being leveraged by CAPTC, Denver Prevention Training Center, and San Francisco Department of Public Health. We are currently using GroupSite for the West Region Learning Community, and to support your CDR planning, we developed a CDR subgroup as a space where you can learn from and support other health departments that are finalizing their CDR plans. In this subgroup, you can create and engage discussion threads about CDR related topics and share resources and other materials to facilitate the development of a CDR plan. As your regional TA provider for CDR, CAPTC will be there to support you by providing TA and sharing CDR related resources in the subgroup, such as this presentation and CDC guidance on HIV cluster detection and response. So this concludes our presentation. We look forward to seeing you on Wednesday, February 24th at 10 a.m. Pacific time for day one of the CDR workshop series.